My name is Matthew Hannibal, and I am a spine surgeon at EmergeOrtho. Outpatient surgery usually means that somebody's coming in and leaving the same day. They don't require an overnight stay in the hospital. The procedures usually lend themselves to being outpatient as long as we feel that the person who is having the procedure can tolerate it. We can do multiple procedures, including disc removals. We can do what we call decompressions, which is taking pressure off of nerves. We can even do procedures such as fusions, both in the neck and in the low back, potentially as an outpatient procedure, which means stabilizing levels with screws or rods, however it needs to be done. When we're picking people who may be candidates for spine surgery as an outpatient, what we're looking for is they have to be generally healthy. We prefer non-smokers, people who have had limited exposure to narcotic medications. They have to have good general health. Heart conditions, lung conditions have to be minimal in order for them to be able to tolerate a procedure and be able to go home the same day. Anesthesia is a big part of how we get patients in and out the same day. So we use what we call multimodal pain control. So you still are usually put to sleep for most of these spine procedures. However, we usually use pain medications before the procedure. We use special types of anesthesia during the procedure, and then types of pain control post-operatively while people are in recovery. And this new combination allows us to keep patients comfortable, but yet keep them awake enough that they are able to go home shortly after the procedure is over. So we will usually work with the anesthesiologist in order to make sure that the patient's a candidate for these types of multimodal anesthetics. If you've had an outpatient procedure, either on the neck or the low back, and it's being done as an outpatient, the first thing is that shortly after the procedure, we're going to try to control the pain as best as possible so that you can go home comfortably. Once you're home, we will provide pain medication to be used at home to make it comfortable. Fortunately, with most of these outpatient procedures, the way they're done and the reason they can be outpatient is because the short-term recovery is usually faster. So we're usually trying to get people up and moving right away. We usually encourage walking. We are encouraging a slow return to regular activities more quickly because of the way the procedures were done. If someone needs a neck or back procedure, I think our first line is to see if they're going to be a candidate for outpatient. We find that they're lower risk, they have a faster recovery, and so we would like to evaluate them for outpatient surgery primarily. If they're not, we can always switch to an inpatient procedure, but we think that outpatient should be at least considered for all patients that are considering some type of spine surgery.